Okay. Today's discussion B. Is about fall risks and bone health for women. Okay. So here we go with the presentation I made for you. Give me a couple seconds to set up the show, and I'll be right with you. Strong practical steps matter. Get a bone density DEXA scan to check if your uh, 60 build calcium, vitamin D into your diet, do regular weight bearing and balance exercises, and make your home fall safe. Adding grab bars, removing tripping hazards, having good lighting. Okay, those add up to safer homes for elderly women. Okay, quick decision guide. What to do first. If you're 60 or older, ask your clinician about a DEXA bone scan, a DEXA density scan, a full fracture risk assessment. This is the single most powerful early detection tool for women. Especially postmenopause, when estrogen levels drop, accelerate bone loss. Decision point: if your T score is 5 minus 5 dash 2.5, or your FRAX score shows high fracture risk, discuss treatment options such as bisphosphonates or lifestyle first approaches, depending on your health profile. If you fall or feel unsteady, prioritize a medication review, vision check, and a structured balanced strength program. Many women don't realize that dizziness from medications or subtle vision changes contribute more to more falls than weak bones alone. Home safety: do a room by room hazard check and install grab bars and non-slip mats. Immediate wins: remove loose rugs, secure cords, and add night lights, and ensure Stairs have railings on both sides. These small changes dramatically reduce fall risk. How to strengthen bones, evidence based. Calcium, aim for 1,000 milligrams a day if under 51, and 1,200 milligrams per day if 51 plus. Food sources: dairy, fortified plant milks, leafy greens, tofu, almonds are absorbed more efficiently than supplements. Use supplements only to fill gaps. Vitamin D, 600 to 800 IU a day, helps your body absorb calcium and maintain bone remodeling. Older adults often need the higher end due to reduced skin synthesis. Ask your clinician whether testing is appropriate, especially in northern climates with long winters. Exercise, combine weight bearing activities, walking, hiking, dancing, stair climbing with resistant training 2 to 3 times a week. Add balance training, Tai Chi, yoga, single leg stands, heel to toe, walking to reduce fall risk. Over time, these practices improve posture, reaction time, and confidence in movement. Fall prevention, practical checklists, medication review, sedatives, sleep aids, some antidepressants, and blood pressure medications can cause dizziness or slow reflexes. Ask your pharmacist or doctor to evaluate your list. Vision, get an annual eye exam. If you use bifocals, or progressives, consider single vision distance glasses for outdoor walking to avoid depth perception errors. Footwear, choose sturdy, non-slip shoes with good heel support. Avoid walking in socks on hardwood or tile floors. Home fixes, install grab bars, secure rugs, improve lighting, especially in hallways and bathrooms. Add railings on both sides of stairs and keep walkways clutter free. Local timely actions. DEXA scan access. Your primary care provider can refer you to regional imaging centers, including UPMC Hammett or Allegheny Health Network partners in Meadville. Typically covers screening for eligible women. Community classes. Check local YMCAs, senior centers, or parks and recreation programs for balance, tai chi, or stretching or strength classes. These group settings also build confidence and social support. Risks, trade-offs, and what to watch for. Supplements. More isn't better. Excess calcium can increase kidney stone risk. Risks or interact with medications. Stay within recommended doses unless your clinician advises otherwise. Hip protractors. Helpful for high risk individuals. Though adherence is often low, they're most effective in long-term care or those with frequent falls. Osteoporosis medications. They significantly reduce fracture risk, but require monitoring. Discuss duration, side effects, and drug holidays with your clinician. Next steps I can help with. Draft questions to bring to your clinician. DEXA, vitamin D testing, medication review. Create a room-by-room home safety checklist tailored to your living space. Identify local balance classes or DEXA centers in Pennsylvania area. Okay, guys, the next half of B is what women need to know. Is really saying a concise, context-based explanation. The page lays out a simple but powerful message. Being female significantly increases the risk of osteoporosis, and women need tailored information at every life stage to protect their bones. The surrounding content builds this message in 4 layers. 1. Women face a disproportionate burden of osteoporosis. The page opens with a stark epidemiology. "80% of Americans with osteoporosis are women. 1 in 2 women over 50 will break a bone because of it. A woman's hip fracture risk equals her combined risk of breast urinary urine and ovarian cancer." The surrounding content explains why women start with smaller bones and lose estrogen at menopause, which accelerates bone loss. Two, risk is not uniform. It varies by race, ethnicity, and age. The page then breaks down how osteoporosis risk shows up differently across groups. Caucasian women, highest rates of osteoporosis and low bone mass. African American women, lower rates overall, but higher prevalence of conditions, e.g., lupus, that increases risk. Also, high lactose intolerance and low vitamin D. Asian American women, high lactose intolerance and high rates of low bone density. Latinas, rising hip fracture rates and widespread lactose intolerance. This section emphasizes that bone health disparities are real and screening gaps persist, especially for African American women. 3, menopause is a turning point and a call to action. The page frames menopause as the moment when bone health becomes urgent. Estrogen drops sharply. Women can lose up to 20% of bone density in 5 to 7 years. Risk depends on both peak bone mass and rate of post-menopausal loss. It also notes that hormone therapy can help prevent bone loss, but comes with risks that require individualized discussion. 4, bone health matters across the lifespan, not just after 50. The surrounding content explains the message to teens, young adults. Pregnant women and breastfeeding mothers, teens can build bone in a way adults cannot. Need calcium, vitamin D, exercise, eating disorders, and an amendoza are major red flags. Young adult women, osteoporosis is rare, but low bone density is not. Secondary causes, medications, medical conditions are common. The overreaching message, osteoporosis is preventable and treatable. This page pushes back against the old belief that bone loss is inevitable. Instead, it emphasizes lifestyle matters, early conversations with clinicians matter, screening matters. Women can act at any age. It's an empowerment oriented frame. You're you are never too young or too old to take care of your bones. DXA testing, DEXA, DEXA testing is not routinely recommended. Pregnancy and breastfeeding. Temporarily bone loss can occur. Most women regain bone after pregnancy. Pregnancy associated osteoporosis is extremely rare. Adequate, adequate calcium, vitamin D, and exercise remain essential. Okay, guys, that is your B for this afternoon. I'll be back on with C shortly. Okay, for now, I'm going to go take myself a little break, and I'll be back on with that for you shortly.